Hi, I'm Harriet Wheelock, Keeper of Collections in the Royal College of Physicians of Ireland. I wanted to start by giving a bit of background to our collections and then talking specifically about the Pandemic Archive. For those of you who don't know, RCPI was founded in 1654 as the Fraternity of Physicians. Royal charters were granted in 1667 and again in 1692, which established the college and gave it regulating and examining powers over medicine, obstetrics and pharmacy. Today the college is Ireland's oldest and largest postgraduate medical education body, and we are also a membership body offering ongoing medical education and training for doctors. And the archive, unsurprisingly, focuses on the history of medicine and medical education in Ireland. As well as the college's own archive, we hold the papers of various hospitals, medical organisations and societies, as well as the personal papers of medics and some medical historians. It would be fair to say that the vast majority of the archive holdings are, traditional physical records, and we are only just starting to dip our toes into digital archives. Most digital material we hold are digital images of physical records rather than born digital archive records, although there is a backlog of born digital material in the college's record management system, that needs to be transferred. So this was a situation in March when the pandemic hit. Clearly COVID-19 has had a massive impact across all areas of society, but it rapidly became very clear that this was going to be a defining moment in medicine, and that through the trainees, members and fellows of the college, I had unique access to some of the people who are going to be most impacted. In terms of why I thought it was important to try and collect the experiences of healthcare workers, I think it's really valuable to look at the 1918-19 flu pandemic, which has frequently been compared to COVID. Dr. Ida Milne's research on the flu pandemic in Ireland has shown the value of first-hand accounts, but also their scarcity. So in the archive in RCPI, we actually only have one contemporary first-hand account of the 1918-19 flu pandemic, and that's in the Diaries of Dr. Kathleen Lynn. As most of you will know, Lynn was the Chief Medical Officer for the Irish Republican Army in the 1916 Rising. In 1918 and 19, she was still heavily involved in the War of Independence and was indeed on the run for some of the period. So perhaps it's not surprising that the flu takes a bit of a backseat in her diaries to some of the other things that are going on in her life. But there are references to her being very busy in the period with flu cases, the numbers she was treated, but there's not really a detailed discussion of the impact of the pandemic on her and the medical profession. As Ida has shown, the official records also tend to break down during this period, as the hospitals and the doctors were under such pressure from treating the flu that they weren't able to keep the usual sort of detailed records that they would. And while later accounts can be really valuable, we do have one example in the archive for the flu pandemic, and this was written by Dr. McNamara, who reflected later on his experiences in the matter. He writes on the helplessness of the medical profession at the time, and perhaps in a way that would, resonate with some medics during the early weeks of COVID. He says, "It was a depressing job ministering to patients with such disease, with death at every corner of the ward, and it sometimes was a negative, though very real comfort, to look out of one of the windows facing towards Berkeley Road of a morning and watch the cavalcade of funerals trotting quietly and inevitably towards Glasnevin. At least one felt, bad as it was in the matter, and God knows it was bad enough, it was just as bad everywhere else, and that the therapeutic wiles of the other city consultants and practitioners were no more successful than those in use in Eccles Street." However, Dr. McNamara's account is written 4 decades after the event, and he himself says in it, "It is now going on 40 years since that terrible time. My memory can hold no more than a general impression of the whole thing." And there's a real, awareness of how memories change over time. And so I think it was really clear from talking to Ida and other researchers that it was going to be really valuable to collect first-hand contemporary accounts written by healthcare professionals as they were facing into the pandemic to get their experiences from the time. But at the same time, I was really aware that this was a group who were facing a huge amount of pressure in work and would have very limited time to reflect and record their experiences. So to make the process as easy as possible, when we asked people to submit their experiences, I didn't stipulate on any format. We said they could write, they could audio, because quite a lot of doctors were very familiar with dictating. They could type, they could send us in images if they felt that they were appropriate. And we put the call out on the RCPI website, we used our social media channels, and then we also used the college's internal communications channels to publicise it. And we've continued to publicise it over the months since April. And to be as inclusive as possible, we also opened the call up to all those working in healthcare, not just the doctors associated with the college. I think unsurprisingly, everything we've received so far has been in digital format. Although some people have said they will be submitting a physical item or diary and object, we haven't received any of these yet. Again, given that the Heritage Centre has been largely closed since March, it would be quite hard for people to submit a physical object to us. It would be fair to say that when I put the call out for material, I kind of put this out first and then considered how I was going to deal with what came in afterwards. I think a lot of other archives were undertaking the same kind of rapid response collecting and probably following a similar process. And lots of people were putting information up online, which was really helpful. So I was able to look at how other archives were collecting consent and how they were collecting material, and then use this to put together a permissions form. So in relation to permissions, we gave people the choice when they submitted material of how they would like their submission to be used. 3 choices, so that the submission could be made available immediately to researchers in our research room, although we're not actually currently open, and then also online via the ICPI website and our social media channels. The submission could be made available immediately to researchers in the reading room, but not online, and that the submission could be closed for a period of years, which could be specified by the person donating the item. We also gave those making a submission the option to submit anonymously. While the Heritage Centre would keep a record of their name, it wouldn't be released to researchers, and they would only be identified by their specialty and location. So, for example, a pathologist working in the west of Ireland. I felt it was important to give this option, as some people might be, I guess, slightly critical of perhaps where they worked or practice that were in place, and we wanted them to be able to talk honestly without worrying about it coming, I guess, back to them later. So how did I manage the submissions? As people began to contact me asking for more information or directly sending material in, I set up a spreadsheet to track these interactions. So it was initially just contact names and contact details, and then the date of contact. This was really helpful, as quite a few of the first people who contacted me said they wanted to submit an account but wanted to wait before they did so until, I guess, it's not a resolution, because COVID isn't over, but there was perhaps at the end of the first wave was a period when people started to submit material. This was especially the case for those who told me they were keeping a diary. They didn't want to submit the diary until it was, I guess, finished. So the spreadsheet was really helpful for tracking these promises that I could then follow up with later on. As submissions began to arrive, I extended the spreadsheet to include details of what had been submitted, when it was submitted, had they received, and more importantly, had they completed and returned the permission form. And then for each submission I created, or actually for each contact, I created a folder which contained copies of any email correspondence, and then as things progressed, the submission itself and the permission form. So at this point, I thought it might be interesting to pause and look at the kind of submissions we were receiving. Interestingly, most of the early written accounts I received were written by healthcare workers who had contracted COVID and were writing about their experiences as a patient, not as a doctor. So one example is from Dr. Anna Rakovac, who's a consultant chemical pathologist in Tala University Hospital. She contracted COVID at the end of March, so quite early on, and she submitted a post that she had originally put on Facebook in which she talked about her experience of the disease. And the reason she felt it was important to share her experience, particularly at that time, she said that there were too many people believing stupid conspiracy theories. She also really interestingly talked about her guilt about being ill as a doctor. She says, I am a doctor. We always feel like frauds when we are ill. I don't know where this comes from. An overgrown sense of duty, a subconscious Übermensch idea, both. We take sick days so rarely. We wear our work ethic as a badge of honour. We are idiots. That's Irish for idiots. More recently, the written accounts I have received have focused on the experience of working on the front line as a doctor, and are probably more like what I expected to receive when I first put out the call. I don't know why this change has happened. I don't know if maybe over the summer, as the first wave kind of passed, there was more time for frontline doctors to reflect and write about their experiences, and that maybe a little bit of distance from the pressures of March and April helped them. It's not only written narratives we've received. As some of you may know, during the first months of the pandemic, we ran a social media campaign called Pause for a Poem, in which we encourage people to take a few moments out of their stressful day to enjoy a poetry reading. So the readings were largely recorded by medics, and many submitted their own works written in response to COVID. So, for example, Professor Gay Canan, who's the Director of Health and Wellbeing in the college, recorded a poem she wrote, Hope in the Time of Corona. And we shared this as part of Pause for a Poem. And then later, she also submitted this, as well as some other items, to the Pandemic Archive. And in the archive, we have both the written and audio form of her poem. And we've also received a number of visual images, and this is probably one of the most striking. You might recognise it as part of a series of photographs that were taken by the photographer Ruth Majeb of people standing in their lighted windows at dusk during lockdown. So Ruth happened to include in this project one of our fellows, Professor Fidelma Fitzpatrick, who the photograph was taken on Fidelma's wedding anniversary, but as she and her husband Martin were practicing social distancing at home, they were photographed separately. I realised when I was putting this talk together that actually the tweet that Ruth shared with the originally with the picture and then the responses to it would be really interesting to capture as well. You know, the engagement rate, the responses, people thanking Fidelma for her contribution, they're all part of the pandemic story. I think that social media has been really important in this pandemic, and I'm not really sure how we go around capturing it. And interestingly, all three examples that I've included originally appeared on social media, and that's probably part of their story as well. So the three examples show the range of submissions we've received. We've received text, we've received audio and visual, but they've all been in digital formats. So the next question for me is having collected this material, how can I make it accessible within the restrictions imposed by creators? So I use the archiving software Calm to catalogue the archive, and we have the Calm View, which is the online catalogue. This was upgraded to the latest version in March, just as we went into lockdown, completely coincidentally. And at the same time, the college also purchased the basic version of the new digital asset management add-on for Calm, which makes it much easier to share digital files through the catalogue. This timing turned out to be really fortunate, as I've been largely working from home since March without most of the collections. And one of the tasks I was able to do during lockdown and afterwards has been to share the images of archive items that we already had and add them to the collection. Given that we've been close to researchers since March, this has been one of the few ways we can provide access to material. So this is just one example. I always love this picture. This is of the rather wonderfully named Surgeon Butcher, who was a surgeon in Dublin in the middle of the 19th century, and who apparently used to impress his medical students by showing them his admirable biceps during anatomy classes. So although it wasn't the original intention when we purchased the digital asset management software, it does also provide a potential solution for the digital preservation needs of the Pandemic Archive. So once I've uploaded digital objects into the software, it automatically creates a lot of the metadata and preservation checks needed. And this just gives you, there's just a screenshot here of the back end of what it looks like when something's uploaded. However, as every archivist knows, not everything can be catalogued as soon as it is received, and there is often a gap, sometimes quite a large one, between accessioning something into the collections and cataloguing it, at which point in case of digital objects, it would be ingested into the digital asset management software. So this is where I do need to take some steps to ensure the integrity and fixity of the digital object, and Kieran, who from the National Library, who's going to be speaking later, has been really helpful in suggesting free and simple to use solutions for how I can do this. I'm not going to talk really about these now, as I expect he will then talk about them much more logically later on. But I do want to say that his really practical approach has given me much more confidence in this area, and I do feel like I could put the steps in place now that would meet the basic requirements. And that obviously once I've done this for the Pandemic Archive, I would then be able to implement it across future digital items that we take in. So carrying out this rapid response collection in response to COVID has been a new experience for me and has presented some new challenges, and a lot of them have been around the digital nature of the records we received. So I've had to develop a new methods to track, record and store donations, particularly those coming in digital formats. While I have addressed most of these to some extent, and there is some pretty good practices in place now, I'm sure there are improvements that can be made, and I'm hoping I'm going to pick up some tips from the talks later on today. Making the submissions accessible is going to be the next step, and obviously this presents additional challenges. I am really lucky that having just upgraded our cataloguing software at this point, and this will help address most of these issues for me, but not all of them, and I do realise that a lot of archives don't have the kind of software that I do. So I hope this presentation has been useful and has provided an insight into my experience of pandemic collecting. And I'm really looking forward to hearing how others have dealt with similar issues. And again, I especially want to thank Kieran for the time he's taken to share his expertise in this area with me. Finally, I wanted to finish by sharing one of the most recent submissions to my pandemic archive. It's a short music composition by Dr. Owen Monahan. I can't say that I was expecting to receive a specially written piece of music when I put out the call in April. I think it just goes to show the really varied ways that people have responded to COVID and also responded to the call for material. And it is the first piece of music that we've ever accessioned into the archive. So the piece is called The Taming of Corona, and in Dr. Monahan's word, it goes from the matador-type aggressive attempt to control to a more cerebral approach, including acceptance.